Lumbar spinal stenosis, or LSS, is a condition where the spinal canal in the lower back narrows, putting pressure on the spinal cord and nerves. This narrowing can lead to pain, numbness, and weakness in the lower back, buttocks, and legs. LSS often develops gradually and is most common in older adults, though it can affect people of any age. Causes range from age-related degeneration and injuries to congenital factors and tumors. Early diagnosis is crucial for managing symptoms and preventing further progression. With the rise of advanced imaging techniques, particularly MRI, clinicians can now detect and assess LSS with greater accuracy, paving the way for innovative solutions in patient care. Magnetic resonance imaging, or MRI, plays a central role in diagnosing lumbar spinal stenosis. MRI scans provide detailed images of the spine, allowing doctors to visualize the spinal canal, vertebrae, and intervertebral discs. Both axial and sagittal views are used to assess the degree and location of stenosis. These images help identify the specific areas where nerves may be compressed, guiding treatment decisions. The ability to distinguish between normal, mild, moderate, and severe stenosis is essential for tailoring interventions to each patient's needs. As imaging technology advances, so does the potential for more precise and early detection of spinal conditions. Artificial intelligence is revolutionizing medical imaging, especially in the field of spinal disorders. AI algorithms can analyze MRI scans rapidly and with high accuracy, supporting clinicians in detecting, segmenting, and classifying abnormalities. These systems can process vast amounts of imaging data, identify subtle patterns, and even predict disease progression. By integrating AI into the diagnostic workflow, healthcare providers can improve efficiency, reduce errors, and offer more personalized care. The adoption of AI-powered tools is transforming how lumbar spinal stenosis and other spinal conditions are managed, marking a new era in medical diagnostics. AI applications in lumbar spinal stenosis prediction span several core tasks. These include detection, identifying the presence of stenosis, segmentation, outlining specific spinal structures, classification, grading the severity of stenosis, and hybrid approaches that combine multiple tasks. Additionally, AI can measure spinal indices such as canal diameter and disc area, providing quantitative data for diagnosis. Explainable AI frameworks are also emerging, offering insights into how models reach their conclusions. Together, these tasks enhance the accuracy and interpretability of LSS predictions, supporting clinicians in making informed decisions. Evaluate the landscape of AI-powered solutions for LSS. Researchers conducted a systematic review following PISMA and PICO guidelines. They searched major databases, PubMed, Web of Science, ScienceDirect, and IEEE Explore, covering studies from 2005 to 2024. The review process involved removing duplicates, screening titles and abstracts, and conducting full-text appraisals. Quality assessment was performed using the MetaQAT tool, ensuring only high-quality, relevant studies were included. This rigorous approach provides a comprehensive overview of current AI techniques, their strengths, and areas needing further research. Systematic review began with the identification of 1,323 records across 4 databases. After removing 97 duplicates, 1,226 records were screened by title and abstract. This initial screening excluded 895 records, leaving 331 for full-text review. These, 184 were excluded for lacking AI relevance, resulting in 95 key articles for in-depth analysis. The process was supported by advanced tools like Rayon for duplicate removal and MetaQAT for quality appraisal. This meticulous screening ensures that only the most relevant and high-quality studies inform the review's conclusions. Quality assessment is vital in systematic reviews. The Meta-Quality Appraisal tool, or MetaQAT, evaluates studies based on relevance, reliability, validity, and applicability. Each article is scrutinized to ensure it meets rigorous standards, minimizing bias and maximizing the reliability of conclusions. In this review, 147 articles underwent MetaQAT assessment, with 52 excluded due to high risk of bias. The remaining 95 articles form the foundation for understanding the current state of AI in LSS prediction, providing a trustworthy evidence base for future research and clinical practice. Recent years have seen a surge in AI research focused on lumbar spinal stenosis. Segmentation tasks have dominated the field, especially since 2019, reflecting a growing emphasis on precise anatomical delineation. Classification and detection tasks have also seen significant contributions, with hybrid approaches, combining segmentation and classification, gaining traction. These trends highlight the increasing complexity and integration of AI models, aiming to tackle the multifaceted challenges of spinal imaging and diagnosis. A variety of MRI datasets support AI research in lumbar spinal stenosis. These datasets typically include axial and sagittal T1 and T2 weighted images, annotated by experts for tasks like detection, segmentation, and classification. Publicly available datasets, such as those from Suderman et al., Graf et al., and the RSNA 2024 competition, provide valuable resources for benchmarking AI models. However, many datasets remain private, and few include accompanying medical text reports, limiting the development of explainable AI solutions. Expanding and standardizing datasets is essential for advancing AI in spinal imaging. Accurate annotation is crucial for training and validating AI models. Experts label MRI scans based on established grading systems, categorizing stenosis as normal, mild, moderate, or severe. Annotations may be pixel-wise for segmentation, bounding boxes for detection, or image level for classification. Double-blind labeling and consensus meetings help ensure consistency and reliability. Standardized annotation protocols enable reproducible research and facilitate the development of robust AI models for LSS prediction. For the rise of deep learning, conventional AI approaches like artificial neural networks and logistic regression were used for predicting surgical outcomes and complications in LSS patients. These models relied on clinical and demographic data, achieving reasonable accuracy but limited by their dependence on handcrafted features. As imaging data became more central, the need for models capable of processing complex visual information grew, setting the stage for the adoption of deep learning techniques. Deep learning models, particularly convolutional neural networks, CNNs, have shown remarkable success in detecting lumbar spinal stenosis from MRI scans. These models can identify central, lateral, and foraminal stenosis with high sensitivity and specificity. Techniques like YOLO and faster RCNN enable rapid detection and localization of abnormalities, even in large datasets. Data augmentation and transfer learning further enhance model performance, making deep learning a powerful tool for early and accurate LSS detection. Segmentation is a cornerstone of AI-powered spinal imaging. By delineating structures like intervertebral discs, thecal sac, and vertebral bodies, segmentation models provide detailed maps of the spine. Advanced architectures such as UNet, MARNet, and FCDenseNet achieve high accuracy, supporting precise measurements and diagnosis. Segmentation enables clinicians to assess spinal deformities, plan surgeries, and monitor disease progression. Despite challenges like data variability and annotation effort, segmentation remains a key focus in LSS research. AI models excel at classifying the severity of lumbar spinal stenosis. By analyzing segmented regions or entire MRI slices, classifiers assign grades, normal, mild, moderate, or severe, based on established criteria. Multitask models can simultaneously assess multiple spinal conditions, such as disc herniation and nerve root compression. High classification accuracy supports clinical decision-making, ensuring patients receive appropriate interventions. Continuous improvements in model architecture and training data are driving even greater reliability in automated grading. Hybrid AI models combine multiple tasks, such as segmentation followed by classification or measurement, to enhance diagnostic accuracy. For example, a model may first segment the spinal canal, then classify the degree of stenosis, and finally calculate spinal indices. These integrated workflows leverage the strengths of each component, providing comprehensive assessments from a single MRI scan. Hybrid approaches are particularly valuable for complex cases, where nuanced analysis is required for optimal patient care. Spinal indices measurements, or SIM, provide quantitative data on spinal anatomy. AI models can automatically measure parameters like canal diameter, disc area, and foraminal width from MRI scans. These measurements are essential for grading stenosis severity, planning treatments, and tracking disease progression. Advanced regression models and attention mechanisms improve the accuracy of SIM, enabling objective and reproducible assessments that support both conservative and surgical decision-making. Explainable AI, or XAI, addresses the need for transparency in medical AI models. Techniques like visual heat maps, e.g., GradCam, highlight regions of interest in MRI scans, showing clinicians exactly where the model is focusing. Textual explanations translate complex predictions into understandable language, bridging the gap between AI outputs and clinical interpretation. XAI enhances trust, supports patient-provider communication, and ensures that AI-driven decisions are transparent and accountable. Combining visual and textual explanations provides a comprehensive understanding of AI predictions. Visual heat maps pinpoint the anatomical regions influencing the model's decision, while textual reports describe the findings in clear clinical terms. This dual approach not only aids clinicians in verifying AI outputs, but also improves patient understanding and engagement. As XAI techniques evolve, they are becoming integral to the safe and effective deployment of AI in healthcare. Integration of large language models, LLMs, with vision-based AI is opening new frontiers in medical imaging. These hybrid models can generate detailed textual reports, answer clinical questions, and provide interactive explanations based on MRI scans. By combining image analysis with natural language processing, vision language models enhance the interpretability and usability of AI tools, making them more accessible to both clinicians and patients. Despite significant progress, challenges remain in AI-powered LSS prediction. Data scarcity, inconsistent annotations, and variability across MRI systems hinder model generalizability. Harmonizing datasets from different vendors and improving annotation protocols are critical next steps. Advances in self-supervised and active learning may help address labeling bottlenecks. As explainable AI matures, multimodal explanations, combining visual, textual, and interactive elements, will further enhance trust and adoption in clinical practice. AI-powered predictive solutions are transforming the diagnosis and management of lumbar spinal stenosis. From advanced detection and segmentation to explainable vision-language models, AI is enhancing accuracy, efficiency, and transparency in spinal imaging. Ongoing research and collaboration between technical experts and healthcare professionals are essential for overcoming current limitations and realizing the full potential of AI in patient care. As these technologies continue to evolve, they promise to improve outcomes and quality of life for individuals affected by spinal disorders.